And we're going to walk through some more specific examples with Drew, but here's a very generic mailing example, if you will. So here we're seeing some opportunity areas to actually employ some of those behavioral science tactics that we see used in other industries all the time and actually capture them here in a letter. The first tactic, for example, is using authority or a very direct tone. In this case, it's the chief medical officer. And we know using signatures with some clinical designation with the right audience has provided a 10 to 15% lift. Now, I say with the right audience because you obviously need to use data to understand that population really well. For example, we have done this outreach for other populations in different geographic locations where using a celebrity actually has worked better than using the chief medical officer, but not every time. So you need to know when the right tool is in the toolbox and when to use it. And the best way to understand that is with data. So you can see some of these other behavioral science tactics along the left side here. Cognitive load reduction seems quite simple, right? You don't want to list 100 things for folks to do. We've seen letters sometimes with 15 calls to action. 3 is really what you want to aim for here. And you can see, make sure they're called out. Using the PS um, opportunity, the PS is actually one of the most widely read parts of any letter. So if you can keep it in there, if you can make it fit, we always say keep the PS. And often it has this sort of last sense of commitment from a behavioral science perspective. And we see a campaign with a PS can often have a lift of 5 to 10% in additional incremental lift. So some of these tactics, the last one I'll just cover, urgency. In this particular example, we're seeing urgency called out. It's what is that call to action? It's called out in the Johnson box on the top right. That tactic alone is an additional 5%. So each one of these tactics, when used in concert, can really drive your intended behaviors.